Welcome back to Addictopydia, the channel where we explore the science, psychology, and stories behind addiction and recovery. Today's topic is a powerful one. Addiction rarely acts alone. When we think about addiction, many imagine it as a single issue: alcohol, drugs, gambling. But the truth is, addiction almost never exists in isolation. Understanding this connection is the first step toward real recovery. When we say addiction rarely acts alone, we mean co-occurring disorders, where addiction and mental health challenges happen together. Someone may drink heavily not just because they enjoy alcohol, but because they're battling untreated depression. Another person may misuse opioids to numb the flashbacks of trauma. In fact, studies show nearly 50% of people with substance use disorders also experience a mental health condition. So, addiction is often more of a symptom than a standalone problem. Recognizing co-occurring issues lets treatment aim at the whole person. Another major factor that walks hand in hand with addiction is trauma. People who experience abuse, neglect, or violence are at much higher risk of developing substance use disorders. Take this example. A soldier returning from war might use drugs to quiet PTSD nightmares, or a survivor of childhood abuse might turn to alcohol to silence emotional pain. This is why treatment that only addresses substance use, without exploring trauma, is rarely successful long-term. Addiction and mental health feed off each other. Depression may drive someone to drink, and heavy drinking may worsen depression. Anxiety may push someone towards sedatives, and sedative misuse can worsen anxiety. It's a vicious cycle. And unless both conditions are treated together, recovery often stalls. That's why modern treatment focuses on integrated care, mental health therapy, and addiction treatment together. Integrated approaches increase the chance of lasting recovery. When both are addressed, people have a better shot at healing. It's not just mental health. Sometimes addiction links up with other addictions. For example, someone might quit alcohol but develop a gambling problem. Or a person addicted to prescription painkillers may also use stimulants to balance out the effects. This phenomenon is called cross-addiction, where one addiction shifts into another. If root causes like stress, trauma, or unresolved emotions aren't addressed, the problem can simply shift form. That's why treatment needs to look past the surface behavior. Let's bring this down to a real-world scenario. Imagine Sarah, 32, struggling with alcohol. At first glance, you might think the problem is just drinking. But therapists discover she also has severe anxiety and unresolved trauma from a toxic relationship. If treatment focused only on alcohol, like detox and abstinence, she might relapse within weeks. But treating anxiety with therapy, teaching coping skills, and addressing trauma changes her chances. Sarah's chances of long-term recovery increase dramatically when the whole person is treated. Her story reflects what research confirms. Recovery works best when we treat the whole person. So here's the bottom line. Addiction rarely acts alone. It's usually tied to mental health struggles, trauma, or other addictive behaviors. If you or someone you love is struggling, look beyond the surface. Ask not just what are they addicted to, but what's driving it underneath? True recovery doesn't come from treating addiction alone. It comes from treating the whole human being. Thank you for watching today's episode of Addictopydia. If you found this helpful, please like, share, and subscribe for more insights into addiction and recovery. And remember, addiction may rarely act alone, but neither should you. Support and healing are always within reach.